Hi, this is Joseph Pate, better known as Medicare Joe, and I want to thank you for joining our Medicare Made Simple webinar here today. And that's just the goal of our presentation, is to make Medicare simple. Simple to understand, simple to know your options, as well as simple to enroll. So it looks like we have about 150 attendees in here already. So we're going to go ahead and get started. I know there was a few more that were trying to join, so we'll let them come in as they come in. But I want you to grab a pen and paper. There is going to be a ton of notes for you to take today. You're welcome to take screenshots of the presentation as well. And I want to start with just letting you know that over the years of helping folks with Medicare, I've seen situations where folks have made the wrong choice or the wrong decision with getting onto Medicare. And it has created financial hardships for those folks. So there's an old adage, you don't know what you don't know. And the goal of our conversation here today and presentation is to alleviate all of the unknowns, so that way you can make an educated decision and find the right Medicare enrollment tailored for you. So that's the goal of our presentation here today. And before we jump into everything, I'm sure you're probably sitting there saying, well, Joe, that sounds great, but who are you and where do you come from? So let me tell you a little bit of a background on myself, and then we will dive right into the presentation. So I've been a licensed insurance agent now for about 10 years. I initially started with small group insurance, helping companies of 1 to 50 employees. And it was about 6 years ago now that I heard of the Medicare space through my grandparents. More to come on that. But now we're licensed in 32 states and help folks with their Medicare every day across the country. So back to my grandparents, I'm from a small town here in Rhode Island. All of my family is from Rhode Island, and I'll probably never get to escape Rhode Island for that. But about 6 years ago, my grandparents that live right up the street came to me and said, well, you're in insurance. Can you help us with this Medicare stuff? And boy, was I in for a treat. After about a year's worth of watching YouTube videos, attending seminars, reading the Medicare New guidebook front to back, I finally gained a grasp on what Medicare actually was to be confident in giving them assistance with their plan. So we helped them with their plan, and then I shop their plan every single year now during their renewal to make sure that they're still in the best position. So fast forward to today, and the reason I'm telling you all of this is because at that point I knew that there had to be other people out there that were in the same boat and had no idea how this Medicare space worked. So at that point 6 years ago, I devoted all of my attention and focus on helping folks in the Medicare space be able to understand Medicare, so that way they could make an educated decision and choose confidently in the plan that they wanted for their Medicare enrollment. So at this point today, I've taken that year's worth of knowledge and put it into about a 45-minute presentation for us here today. And that way, you don't have to go down the same rabbit hole that I went down of trying to learn Medicare all on your own. Now, for everybody that's in here today, I have a surprise that I'll be giving away, which is 2 free bonus items for everybody that has attended here today. So these bonus items, I'm going to be giving them away at the end of the webinar because they're just not going to make any sense to you now. We haven't gotten into any of the material. So at the end of the webinar, make sure you stick around. I will go over what those bonus items are, as well as how you'll be able to get them at the end. So without further ado, I want you to grab a pen and paper, and let's dive into the Medicare Made Simple webinar. So as we jump into the presentation here, I do want to note though that there is a chat available on the side. My assistant is going to be monitoring that. So as questions come up through the webinar, you're welcome to put those in there and she can respond. It has been made private to avoid confusion from everybody else's questions. I know that there's a lot of folks in here and everybody's situation might be different. So we have made it private, but you're welcome to put your questions in there and my assistant can answer those as we go through. Also, make note of my contact information here below. So our company number, 888-676-3633. Any questions that do come up after the webinar, you're welcome to reach out and also ask us any questions you have. So to jump into everything here, we're going to start out very basic, and we're going to go over the parts of Medicare. So all of these parts have something to do with Medicare, but they're not all necessarily Medicare. So I'm trying to illustrate that here with Part A being your hospital coverage and Part B being your medical coverage. This is what's known as original Medicare, where you'd be actually insured by Medicare. Part C, Medicare Advantage, which is probably what you've seen on TV, a lot of the commercials. This is actually the alternative to original Medicare. And then Part D would be a prescription drug plan. It's just a standalone policy by itself. So again, all of these parts have something to do with Medicare, but they're not all necessarily Medicare. So I am going to go over original Medicare here first. We're going to walk through what that actually is and a little bit more of a breakdown. So Part A, this is your hospital coverage. And as long as you or your spouse have worked at least 40 quarters, so a total of 10 years, you will get Part A for free. There's no premium for Part A. Part B, which is your medical coverage, I call it everything else outside of the hospital. So this is going to be like doctor visits, testing, lab services, surgeries, everything like that would actually fall under Part B. Now, Part B does have a monthly premium associated with it. It's going to be, the standard premium is $164.90 per month. And this can differ based on your income. So if your income is below $97,000 a year, filing individually, and $194,000 a year filing jointly, you will pay the standard premium of $164.90. If your income is above those thresholds, the monthly premium will be incrementally higher depending on the income bracket that you fall into. So if your income is above that, that's something we can touch on and show you exactly what your Part B premium would be. But for most folks, it's going to be the $164.90. So in terms of getting Medicare A and B, if you're already receiving Social Security now, or you will be before you turn 65, you're going to be automatically enrolled in Medicare A and B. You're going to receive your Medicare card about 3 months before you actually turn 65. And that Part D premium, that's going to come right out of your Social Security check monthly. So there's no action for you to take to sign up if you're already receiving Social Security. If you're not receiving Social Security benefits yet and you intend to start Medicare, you're going to have to take action and sign up. And this process will happen 3 months before your 65th birth month. So there's a couple of ways that you can do this. You can do this online at the Social Security website. There's a big blue button at this link that says apply for Medicare only. You can do it over the phone or in person at your local Social Security office. Now, if you're not receiving Social Security benefits and you're going to start Medicare, you're actually going to be billed on a quarterly basis for that Part B premium. So I've done out the math here for you. So every quarter you're going to be billed $494.70, and that would pay for 3 months worth of insurance. You'll do that until you actually start to take your Social Security, and that's when they'll just take it out monthly before they send you your Social Security distribution. So that's how you sign up for Medicare if you need to. As far as when the coverage actually begins, the coverage is always going to begin on the first of your birth month, unless your birthday is on the first. So for the majority of you, if your birthday falls between the 2nd and the 31st, so let's say your birthday is May 25th, your coverage is going to start on May 1st, the first of your birth month. If your birthday is on the first of the month, they actually will start your Medicare the month prior. So I put a little example here. If your birthday was June 1st, your Medicare effective date would actually be the 1st of May. So the month before. As far as we talked about how to get on Medicare, when it would start, but a big question for a lot of you in here is going to be, does it make sense for you to start Medicare at 65? Now, if you're retired or you have no insurance or you have individual marketplace plan, you're going to have to get on to Medicare at 65 to maintain credible coverage. But if you are still working or your spouse is still working and you are covered by that employer plan, so they're actively employed and you have coverage through that employer, you can actually delay your Medicare enrollment altogether until a future date when you're ready to retire. And for some of you, that may make sense to do. I put a couple of factors here to consider when going through that. One is going to be the medical out-of-pocket cost. So does your plan have a deductible that you're hitting every year? What are the premiums for your plan? Is it more affordable for you to stay on that policy over Medicare? Are you taking any high-cost medications currently? Sometimes the employer plans will cover that better than Medicare itself. And then the last one here is, do you have a spouse that's under 65 that's dependent on being on that group coverage? So all of these factors we can discuss and kind of map out for you to see if it makes sense for you to start Medicare or delay that until a future enrollment date. So again, as long as you're actively employed and have coverage through that employer, you may be able to delay your coverage until a future date. So we've been talking about original Medicare, and I do want to go over the exposures of original Medicare and how this isn't going to be an option or the best option for you, an option that you should consider at all, in my opinion, by itself. So if you have just Part A and Part B, Part A, you have a $1,600 deductible for any event, any medical event that you're hospitalized. So this isn't a one-time deductible for the year. This is a per benefit period event. So let's say you're hospitalized in January, you'd have a $1,600 deductible that had to be met. If you're hospitalized again in June, another $1,600 deductible to be met, again in September. So obviously that can add up by itself just for the hospital stays. But also with Part B by itself, you have an annual deductible of $226 that you have to meet for the year. And then you have a 20% coinsurance that you have to pay that doesn't have a cap. There's no limit to that. So you're paying 20% of the medical bills again, there's no limit. So original Medicare by itself never makes sense for someone to go on. And that leads me to what I call the two roads, and I tried to make a little graphic here for you. Basically, there's two roads or two pathways when you're getting onto Medicare that are going to make sense for you to do. And this is always the first decision for someone to make, is to decide what road they want to go down. So one of which is Medicare Supplement or a Medigap policy. And this is something that will be added to your original Medicare. The other is Medicare Advantage, which is Part C. And I want you to take this note down. If you're taking any notes, this is the note to have. I'm going to bring up the right side of this piece of paper in a second, but this is going to be the best illustration to decide which road you want to go down. Again, the left side would be original Medicare as your primary insurance. And then you'd be adding a Medicare Supplement to pick up the gap that Medicare doesn't cover, which I just illustrated, the exposures. And then you'd be adding a Part D drug plan. So this is one way that you can have your insurance work. The other way on the right side is Medicare Advantage. So again, this would be the alternative to Medicare. I'm going to go over that a little bit later and discuss how that works. I'm going to start with the left side, and then we're going to come back to the right to try to make it as easy as possible to understand. So when we break down the left side, the Medicare Supplement option, basically how this would be structured is you would have original Medicare as your primary insurance. Let's just say it's covering you at 80% to make it easy. Let's say Medicare covers 80%. You would then add a Medicare Supplement plan to pick up the 20% gap that Medicare doesn't cover. So what you're effectively doing here is you're paying an additional premium for the supplement to avoid having to pay any medical bills out of pocket because you now have 100% coverage. There's a lot of benefits of having a Medicare Supplement. I've listed some of them here. Basically, there's no large out-of-pocket expenses that you'll have to worry about. If you're hospitalized, have any surgeries, you're basically paying nothing. You have the freedom to choose doctors and hospitals. There's no networks or referrals that you have to worry about. The biggest one here is there's no prior authorization. So what that is basically if Medicare deems it medically necessary and you and your doctor, choose that option to go with, whether it's surgery, etc. If it's medically necessary, it's going to be paid for. You're not bringing in a third-party carrier, insurance company, to determine if it's allowed or not, right? So no prior authorization is a big one for Medicare and a supplement. And this is also a guarantee renewable product, so it's not going to ever be terminated. The only way you can be terminated is if you don't pay your monthly premium. So again, a lot of benefits of Medicare with the supplement, and I want to go one step further into the weeds and kind of look at, okay, we have this 20% gap in coverage, and if we look at this chart, basically this is illustrating how that 20% can be covered. So this may look like a lot, but we're going to make Medicare simple. So I've highlighted 2 plans here, and these 2 plans are basically really the only options that ever make sense for someone to pick when they're getting onto Medicare and they want to go with the supplement plan. Because, as you can see this chart, they cover the majority of the exposures that Medicare has at 100%. One thing to note before we go into the plans and how they work is that the supplement plans are all standardized. So what that means is a plan G with one carrier is the same exact thing as a plan G with another carrier. They're no better, no worse. So when we're talking in terms of a plan letter, no matter what company is out there, they're all going to provide the same level of coverage for that plan letter. So let's talk about Plan G, and if we had chose this as our supplement, how it would work. So Medicare Supplement Plan G and how it covers the 20% gap is it's going to cover the full 20% gap in coverage for Part B. It's also going to cover the hospital deductible that you have on Part A as well. So if you chose Plan G to be your Medicare supplement and work with Original Medicare, the only cost that you'd actually have on the plan is a one-time deductible of $226 for the year. Once you satisfy this deductible, no matter how many medical bills you have come up, you pay nothing. Everything's covered by Medicare in your supplement. So this is like your Cadillac tier, top tier coverage that you can pick. Coming back to the chart, I want to go over Plan N. And as we look through G and N, the 100% coverages pretty much mirror each other as we go through here. Obviously, the Part B deductible is missing. We just went over that. And Part B excess charges is missing as well. We'll touch on that. But you have the Part B coinsurance and copayment, and you have asterisks here next to that. So when there's ever asterisks, there usually means there's more to be had there. So let me dive into Plan N and explain how that'll work. Plan N is very similar to Plan G. It will cover the hospital deductible, so you don't have to pay that. It will cover the 20% coinsurance as well. You do have to pay your Medicare deductible. So that's going to mirror the G. You're going to pay the $226 deductible first. The difference with Plan N is once you meet that deductible, if you were to then go to the doctor, and this is where those asterisks came in, if you were to then go to the doctor after you paid the deductible, you'd have a $20 copay at your doctor. That's any doctor, specialist, primary care. And you'd have a $50 copay at the emergency room. So again, 20 at the doctor, 50 at the emergency room. Now, that's how it differs with those asterisks that were in that chart. But I do want to go over what excess charges is, because that was left blank as well. And this is kind of getting a little in the weeds, so I don't want to lose you here. We're just going to touch on this briefly. Part B excess charges, think of that as you have doctors that accept Medicare, and then you have doctors that will accept Medicare assignment, which is basically the approved amount that Medicare wants the doctor to take. So for doctors that do not accept Medicare assignment, they can charge up to 15% more than the Medicare approved amount. In certain states, this doesn't even exist. They cannot charge excess charges. So if you live in one of these states here listed below, excess charges do not exist on Plan N. But for the rest of you, less than 97% of doctors do not accept Medicare assignment. So 97% of doctors do accept Medicare assignment, meaning that of all the doctors in the U.S., 3% of those doctors will actually be able to charge you more than 15% of what the Medicare approved amount is. So I put here in big, bold green letters that the net result is it really is a minimal role in Plan N because it's virtually never going to happen to you while you're on the plan. In my 6 years of doing Medicare, I've had 2 clients that it's happened to, and we've helped thousands of beneficiaries. So very minimal role in Plan N. So here's a good screenshot to take as well of a breakdown of Plan G and Plan N on how they can compare. Again, you got Plan G, which would have the $226 deductible, and you'd have Plan N, which has that same deductible. Difference here is once that deductible is met, you then have to pay a $20 copay at the doctor and a $50 copay at the ER. Plan N, because you have these copays on it, it usually is about $20 to $40 less per month in premium. So I put here, if you're going to the doctor anywhere from 12 to 15 times a year, that's usually your break-even point when deciding what plan's best for you. So let's look at what the cost would look like here if we chose the left side of that piece of paper, which was original Medicare with a supplement. You'd have your Part A and B, which is the $164.90. The Medicare supplement is going to be anywhere from $70 to $150 a month, depending on your zip code, gender. The prices can vary. And then you'd be adding a Part D drug plan. I put here about $15 a month. Again, that will vary also based on zip code, medications you're taking. But this would be a good idea as far as what the premium would look like if you chose original Medicare with a supplement. In terms of when is the best times to enroll, we've already touched on this a little bit, but if you're going with the idea of original Medicare and a supplement, again, Part A and Part B, this is going to happen 3 months before your birth month, so you'll either automatically be enrolled if you're receiving Social Security, or you'll have to sign up on the Social Security website to get A and B. The supplement plan, this actually can happen up to 6 months before your birth month is when you're able to lock in premium on the supplement plan. We typically recommend doing that as soon as you're within that window because at that point you're locking in the rate 6 months before it actually starts. So you're getting the cheapest rate that you'll see because the rates don't go down, they always go up. You're able to avoid any mistakes that can happen with enrollment. And it's just something you can get checked off your list. There's going to be a few steps to take if you choose this process. So getting this one done first when you can, it always makes sense to do it that way. And then the Part D drug plan, this will actually happen 60 days before your birth month. So this will be one of the last steps that you'd tackle. But this is how your insurance would look if you went the original Medicare with a supplement route. So back to the 2 options. We went over the left side here. Now I'm going to touch on the right, which is Medicare Advantage. And again, I put here alternative to Medicare because when you go on a Medicare Advantage plan, you're not actually insured by Medicare anymore, you're insured by a carrier. And I'm going to illustrate that here on the next slide. So with Medicare Advantage, what it does is it takes your Part A, your Part B, and your Part D, and it lumps it all into one program. So I put here, it's a managed care organization. You're basically insured by a carrier, and you have an HMO or a PPO. So this is going to be very similar to you being insured either through the marketplace or possibly on an employer-based plan where you have one card for everything. So with this option, what will happen is you're going to have copays at the doctor, at the hospital. You're going to have a network of doctors and hospitals that you'll work within. And you're going to have what's called a medical maximum out of pocket. So you'd have a structured summary of benefits where you're paying copays for services, and you'd have an out-of-pocket limit, usually about $6,000, $6,700 I put there a year, if you had a really bad year medically. So again, this is more of a similar option to what you've been insured with so far. And there's a lot of benefits to going on a Medicare Advantage plan. I'm going to touch on those here. The cost, more importantly, is the biggest factor. Is there's usually no or very low additional premium that you'll pay on top of your Medicare premium. To see a primary care physician, it's usually a low or even no copay to see your primary care. These plans will come with prescription drug coverage at no additional cost. They'll usually come with a dental, vision, hearing plan built into the program, again at no additional cost. With Medicare Advantage, in terms of plan options, like we went over with the supplement, it's a little different. They have a number of different plan options based on your zip code and area. So when we plug in a zip code to pull up all the Advantage plans, we might find that there's 15 to 20 different options that we can pick. And that's going to be really tailored to your doctor network that you want to keep, medications you're on, etc. That would be what would show us what Advantage plan would be the best for you. As far as a cost of how it would work, again, there's no additional premium typically on an Advantage plan. So your Part A, your B, and D all lumped together, you'd only pay the Medicare premium of $164.90, which can make this appealing for some folks. In terms of when to enroll, or the best time to enroll, so enrolling in a Medicare Advantage plan does mirror your enrollment into Medicare A and B. You got to be within 3 months of your effective date to do that. And you do need your Medicare card to do that. So as soon as you have your Medicare card and you're within that 3-month window, that is when it would make sense to shop the Advantage plans. And again, it's always best to do that as soon as you're within that window, because it's something that you can get checked off your list. It avoids any mistakes. It gets the plan materials out to you well before the plan actually even starts, so you have time to review all that stuff ahead of time. So again, Medicare Advantage 3 months before. Medicare Supplement can be 6 months before your birth month. So again, these are the two options that you have. I want you again to just note that you have to pick a side here, the left or the right side. That's always your first decision. So in terms of original Medicare with the supplement and Medicare Advantage, I do want to go over the benefits and disadvantages of both. So to start with original Medicare, just to kind of bring this up again, the benefit of original Medicare with a supplement is going to be you have the option to choose any doctor or hospital. Your primary insurance would be Medicare, so there's no prior authorizations or approvals from carriers. There's no referrals needed, and there's no out-of-pocket exposure or surprise medical bills. If you're hospitalized, you pay nothing. If you have surgeries, you pay nothing. That's why you're paying for the supplement plan. Leading me to disadvantages. Obviously, a disadvantage of the supplement is it does require you to pay an additional premium every month. It does not include the dental, vision, and hearing like Advantage does. You can add this, but it would require you to pay an additional premium to add this. It does not include prescription drug coverage. Again, this would also be added. We budgeted about $15 a month on that last slide, but this would be added as an additional premium as well. In terms of Medicare Advantage, there are some benefits of Medicare Advantage. Again, with Medicare Advantage, there's no additional premium that you have to pay, just the $164.90. It comes with the dental, vision, and hearing benefits a lot of times. It comes with drug coverage, and a lot of the Advantage plans have what's called extra benefits. So Silver Sneakers, which is a gym membership program, it does come with that. Over-the-counter reimbursement programs where they give you, a quarterly allowance to use for over-the-counter medication. So those are some of the benefits of a Medicare Advantage policy. But there are some disadvantages of a Medicare Advantage policy as well. There's another old adage is you pay for what you get. So with an Advantage plan, because you're not paying any additional premium, you're just paying your Medicare $164.90, you incur costs on the plan as you use it. So I put here some of the copays you'll probably see on an Advantage plan. You'd have a $35 copay for a specialist. You'd have a $90 copay at the ER. Hospital stay is probably going to be the most costly, $300 a day or a night rather, for the first 4 to 5 nights. So with a Medicare Advantage plan, if you have a good year medically, it can be a good option. But if you have a bad year medically and you incur these co-pays and costs, it can start to add up for sure. Disadvantages of an Advantage plan: you do have a network of doctors that you're going to work within. If you are on an HMO, it will require referrals. Again, there are PPO options that do not require referrals. You have a $6,700 yearly out-of-pocket limit. So again, that can vary depending on where you are. That's just one of the more common ones that we do see. Basically, if you took all of your co-pays in a calendar year, if you ever hit $6,700, at that point, you would no longer pay anything. The insurance company would then cover everything for you. The last one I put here is actually pretty important. I'm going to touch on this again in the next slide as well. You may have to health qualify to go on a supplement after your initial enrollment. And some of you may be asking, well, why is that a disadvantage on the Advantage plan? So let me walk you through a scenario here. When you first start Medicare, you can pick the left or that right side, Medicare Advantage or a supplement, with no health questions asked. However, if you start with the right side, which is Medicare Advantage, because you're healthy now, after 12 months of your enrollment there, let's say your health went south and you're not healthy anymore, and you want to go back to the left side, original Medicare with the supplement, you will have to answer health questions in order to go from the right to the left after your initial enrollment on Medicare. So for some of you, that might not be a problem. Some folks go on the Advantage plan, they love it, they don't pay any premiums or co-pays, and they're healthy and they're happy. But I have seen situations where someone's on an Advantage plan and they've had something come up, cancer, dialysis treatments for kidney failure, and they want to go back to a supplement plan. The problem is after the first year of enrollment, you have to health qualify. And for some folks, you might not be able to if you can't pass through the health questions that are asked. So that's something that's important when you're looking at picking an option here. You do have to weigh not only what's going on now in your health now, but also how you want it to work in the future, because you might not be able to change if you need to later on. So I'm going to take a sip of water here because I'm doing all the talking, and I want you guys to circle on your piece of paper what side you think makes the most sense for you from our conversation here today so far. And then from there, I do want you to also, if we chose the supplement side, which one do we like better, the G or the N? Again, this is just an exercise to kind of build out a plan for you. So you can circle which one you like if you like the supplement side. If you chose Medicare Advantage originally, great. Again, there's going to be a bunch of different options that you can go through on that side. And if you're still not sure which one, that's okay. We still have about another 5 to 10 minutes here before the end of the webinar is up. But at the end, you will be able to schedule a call with myself or one of my team members. And I strongly recommend this. And I'm terrible with surprises, so I'll kind of just get to it now. I put the bonus items in parentheses here. Basically, we give you personalized advice for your situation. It's no obligation, no cost to you. But that's one of the bonus items is a cost breakdown, which basically will give you an itemized list of everything that we've kind of gone over for your area, for your situation. So that way you have a cost breakdown almost down to the dollar of what it would look like for you to get onto Medicare. More to come on that at the end. I'll talk about how to get that, but that's one of the bonus items. Again, we strongly recommend that for you. It really does map out the exact cost of what your option would look like getting onto Medicare. I do want to touch on the drug plan because we did skip over that with the left side before. So I do want to come back to the Part D drug plan and how that works. Now, some of you may be in here and say, well, I don't take any medications at all. I don't want to get a drug plan. And that's fine. You don't have to get a drug plan. What happens though is if you do not have what's called a creditable prescription drug plan when you turn 65, if you opt out of taking a drug plan now and you want to sign up later on down the road, a year, 2, 3 years from now, they charge you a 1% penalty for every month you could have had that coverage but elected not to enroll. 1% might not seem like a lot, but it is for life. So when you eventually do sign up for a drug plan whenever that might be later on down the road, you'd be paying a higher premium than everybody else for the rest of your life. So the drug plans typically, I would say lowest cost. I put $15 in the example there, but you can probably get one for like 10, a little bit less, maybe depending on your zip code. So we always recommend it just because not only does it suffice that penalty, but it also gives you drug coverage in the event you start to fill medications in the middle of the year. In terms of how the drug plan works, there's different stages. And for the majority of you, you will stay within what's called your deductible stage or your initial coverage stage. So the deductible stage would be the amount you pay before the plan actually pays anything. So some plans have deductible first plans where you have to meet your full deductible before the plan pays anything. For the majority of you, you'll fall into what's called the initial coverage stage. And this is the traditional way. It's probably always worked for you with drug coverage, where you pay a small copay. Some of them might be free, but $4 or $5 at most to get your medications. Very straightforward, where you're paying your premium for your plan and you pay a small copay to get your generic medications. For some of you taking higher end medications, you can fall into the coverage gap. And this would be if you accumulated over $4,660 worth of retail costs on your medications. Instead of you now paying a copay for your drugs, you actually pay a 25% coinsurance to get your medications. You would then do that until you get to your catastrophic stage, which would be $7,400 a year in retail cost of medications. And then that would go down to 5%. And I know this is kind of getting really in the weeds. We go over this with you to show you, what the plan would look like, what medications each one would cost, so that way you have a breakdown of everything for you. Again, the majority of folks will stay in this initial coverage stage where you pay a copay for each medication, just like you're doing now. How do we help with the drug plan research? We have a plan finder tool, basically. So what we do is we take all of your medications, your pharmacy that you want to use, and we put it all into a calculator. And that calculator is going to show us maybe the top 2 to 3 options that make the most sense in your area. We go over that plan, how it works, premium, again, copays for each medication, and then we help you select the plan and enroll in the plan. Each year, you're going to be able to reevaluate your prescription drug plan between October 15th and December 7th. That's the annual enrollment period, which you'll be able to pick a new plan for the new year based on your new medications. So with the drug plan, just to touch on that, we do recommend folks pick the plan that makes the most sense for you now, because you'll always have the option to change later on. So I wanted to pull this slide up here to give you an idea. These are the insurance companies that our agency is contracted with. So we're an independent agency. We do not work for one carrier. Think of us as like the middleman, bringing all of the marketplace to you, the consumer. So the reason I wanted to show you this slide is we don't have a bias to one company over another carrier. Our goal is to find the best fit for you, the consumer, and mirror you and what you need to the carrier that best suits you. I want to go over a couple of myths maybe, or unknowns that a lot of people will ask. And one of the most popular questions that we get is, do I have to pay a fee for your service? And the answer to that is no. So our service is completely free to you, the consumer. You don't pay us any fees or anything like that. We get paid commission directly by the carrier. So no matter which plan you pick, or if you go to the carrier, it's the same. So again, the next question that we get is, will the cost be less if I go direct to the insurance carrier? So I did touch on that a little bit here. And the answer to that is no. Again, the cost is going to be exactly the same, whether you use our services and help you through the enrollment process, or go directly to that carrier with all the information we provide. The benefit to using a broker is it provides you with a free advisor in your corner. So that way, maybe one company is good for you this year, but they're not the best company for you next year. Well, with working with an unbiased advisor, they give you a map or an overlook of the whole marketplace, so you know which company is the best for you year over year. So how do we get paid? Great question. So we get paid a commission for bringing the business to an insurance carrier. So the commission itself is the same across the board. So we're not biased to one company, one carrier over another. So basically, if we're able to sign you up for the plan, the carrier will pay us a commission. Again, across the board, we don't have a bias to that. We just want to make sure you're in the best position. So I want to go over today's recap and more or less what we've discussed in our presentation today. So we've talked about the parts of Medicare. We've talked about how original Medicare by itself never makes sense for somebody. We talked about the two roads, which is Medicare Supplement versus Advantage. We've talked about the prescription drug plan, when to enroll into the plans, and why a broker is an asset. So we have all of this information now, and the next question is, well, where do I go from here? So right now you're in stage 1, and that was our online, maybe you've seen our online content on YouTube, our website. You went through today's educational presentation and any other Medicare, research and education you've done. That's stage 1. Stage 2 is going to be get enrollment advice, and you're going to see that gold telephone just popped up. And my assistant just posted the link in the chat as well. And this is where you can schedule your free, no obligation consultation to discuss your specific situation with our team here. Now, on these calls, this is when we're going to give you the 2 free bonus items. So I already hinted at one, which was the cost summary, cost breakdown. That's going to give you an itemized list of your specific Medicare situation, so you have the cost of you getting onto Medicare down to the penny for your area. The second bonus item, or the first one listed here on the slide, is the personalized enrollment timeline. And a lot of people enjoy this one because it basically is a step-by-step guide for you as far as what you need to do and when you need to do it leading up to your Medicare enrollment. So again, these 2 bonus items are going to be given to you on the call. So you'll click that link in the chat or the gold telephone there, and that will bring you to our calendar. We had about 45 spots for the week on there. I do not know how many are left. I'll check the chat. John just put in the chat, he said, Thursday at 4, he booked. Great, thanks, John. So again, I know I can see some of those are going away here already, so I'm going to go over this next stage. You're welcome to listen along as you're booking that call. So stage 3 would be lifetime support. So lifetime support, we have a full customer service team here that we provide free lifetime customer service to you. So if there's ever any claim issues, rate increases, problems with your insurance at all, we provide that to you at no cost. So you're able to use our service that way. And we also provide what I like most importantly is free annual reviews. So this is something that not a lot of folks do. We feel that it should be done throughout the industry in itself. But on the anniversary of your policy, we shop and ensure you're paying the best rate for your plan year over year. So on the anniversary of your policy, we give you a call, we review your plan to make sure that you're still in the best position with everything. So that's going to be stage 3. So right now we're in stage 2, and you're going to want to click the gold telephone now to schedule your call. Again, it looks like there's about 30 left in there now as I'm going through it. Mary said, great presentation. I'm booked Friday at 2. Great, Mary. Thank you. Appreciate that. So again, at this point, you're in stage 2. You're going to book your call, and then myself or one of our team members from here will give you a call for your free consultation and get you those bonus items, so that way you have a plan of action for getting onto Medicare. Again, I know I had my number up at the beginning. Our contact information here, the number again is 888-676-3633 if you want to jot that down. Any questions that you have, my team here would be excited and happy to help you through the process. And I hope you enjoyed the presentation, the webinar here today, and at least took something from our 45, 50 minutes here. So again, any questions that you have, our team will be happy to help you, and you can book your call by clicking that gold telephone or the link that's in the chat. Have a nice day, everybody. Take care.